The broadcast is now starting. All attendees are in listen-only mode.
Hello and welcome to the Puberty Talk, brought to you by the Hemophilia Federation of America's Families and Blood Sisterhood programs. I'm Carrie Koenig, Families Program Manager at HFA. Also on the line today, we have Christy Van Horn, HFA's Programs Consultant. We would like to take a moment to thank Genentech, Novo Nordisk, and CVS Specialty Pharmacy for funding our Families program. We would also like to thank CSL Behring and Shire for their support for our Blood Sisterhood program. Without their generous donations, this webinar would not be possible. Today's presentation is the Puberty Talk. We have an extremely knowledgeable speaker, Christy Van Horn. Christy is a programs consultant for the Hemophilia Federation of America. She has a master's degree in both public health and education. Christy has been working in the field of health promotion for over 15 years and with the bleeding disorders community for 5 years. She has experience working with international, national, and local grassroots organizations on program development and training. Christy is passionate about women's health and healthcare equity. We just want to remind everyone as well that this webinar is for educational purposes only and is not intended to be construed as medical advice or the official opinion or position of HFA, its staff, or its board of directors. Attendees are strongly encouraged to discuss their own medical treatment with their healthcare providers. And with that, we can get started with our webinar. Christy, I'll let you take it from here.
Thank you, Carrie, and I want to thank HFA for addressing this very important topic. I'm excited to be a part of this. I know it can be challenging at times to have these conversations, even more so if your daughter has a blood disorder. So I'm excited to offer some tips and hopefully help the process and the conversation within the community. So what we're going to discuss today is we're first going to discuss an overview of menstruation and ovulation, with some anatomy. I know that can be a touchy topic for some, but it's a very important aspect to cover. We're going to discuss tips on how and when to talk to your daughter about menstruation and their periods. We are also going to discuss the differences and challenges of having a blood disorder during this time in their life. And then to end, we're going to provide some tips and tricks to help you and your daughter prepare. So if you don't have a piece of paper and pen close by, I would encourage you to just pause the webinar for just 1 second and go and get a piece of paper and pen, a journal, anything you can jot down some notes throughout the webinar. I am going to offer some helpful tips throughout, and also just some things for you to consider that you might want to make some notes about, and this is one example of that. So if you don't have a piece of paper and a pen, just pause this for just 1 second and go grab that. So how do we start this conversation? How do we really start thinking about talking to your daughter about her period or about menstruation, about the changes that are about to occur in her life? And one thing that I find particularly helpful for mothers and parents is to consider a memory that they have associated with the first time they got their period, or something that they want their daughter to know that they didn't know. So, we're not in a formal one-on-one setting here, but these are still things that you can think about before you have that conversation. What are some things that you might want to share with your daughter? What are some of your own experiences? What do you wish that you knew? Think about those things before you start the conversation. It can be really helpful for you, and it can also be really helpful for your daughter. It helps them feel less alone. It encourages them to come to you. Lots of little things that can kind of help break down those awkward barriers when you're talking about these topics. So some facts. These are just some quick facts about menstruation. One cycle lasts from the first day of your period to the first day of the next. So your cycle starts on the first day when you get your period and goes till the next first day of your next period. The typical cycle is 28 days, although we know not every woman has a typical cycle, especially when girls are younger. Although some can be as short as 22 days, others are as long as 45. And again, they're often irregular when girls first start menstruating. A general age for girls to get their periods these days is between the age of 9 and 14. I want to stress, and you'll hear me mention this a couple of times, girls are starting to menstruate earlier and earlier. So having these conversations at a younger age is very important as you move forward. And I will talk a little bit more about that. The last thing I want to stress, and you will hear me say this again throughout the webinar, is that everyone is different. We all know that, but stressing it to your teenage daughter who might be comparing herself to all of her friends, especially when she has a blood disorder, just keep reminding her that, you know, her experience and her body changing isn't going to be the same as her friends. And all of her friends will be different as well. This isn't something limited to girls with blood disorders. But just make sure that we always keep that in mind, even as adult women. You know, it's easy to compare ourselves, but important that we don't. So what we're going to do now is just a quick refresher of some anatomy. So we're going to talk about ovulation. Now, I just want to go through, and maybe some of you are actually watching this webinar with your daughters, so I can do the dirty work for you. We can talk about the internal anatomy. So here we have the ovaries. So we have 2 ovaries. Here's one, and everyone can see my arrow. Here's the other. Our eggs sit inside of our ovaries. And then we have the fallopian tubes. You can see here 2 fallopian tubes that go into the uterus. The endometrium is the lining of the uterus. We're going to talk a little bit more about what services, what all of these different parts do in just a second. And then we have the vagina and the cervix that acts as a barrier between the two. And then the external reproductive anatomy, including the vulva, which we'll talk about external anatomy in just a second. So we have 2 ovaries, which I've already mentioned. Ovaries produce hormones called estrogen and progesterone. Each egg that we have holds hundreds of tiny eggs, and we're actually born with all of the eggs we have. An ovary, once we start our periods, what happens is an ovary releases 1 egg about once a month. So I'm sorry, my cursor's not working, but here we go. So the ovary releases 1 egg once a month, and it travels through the fallopian tube and into the uterus. This is called ovulation. So when the egg leaves the ovary and travels through the fallopian tube into the uterus, that is ovulation. So just to talk a little bit more about what happens. So the egg, before the egg is released, there's the hormones we just talked about, estrogen and progesterone, trigger changes to the endometrium. So that is the lining of the uterus here and all around here. So what happens is it builds up a lining, kind of to make a safe haven. Think about like a cushy blanket in a way for the egg. So the egg moves to, once it's all ready for the egg moves through the fallopian tube into the uterus. And if the egg is not fertilized, it begins to fall apart, and the lining that had built up in the uterine wall breaks down and sheds. And that is what's known as our periods. So the period, the lining breaks down, and then what happens is it comes out, and that's what our menstruation is. Okay, so quickly, this is our external anatomy. And the reason I think that this is so important is there are a lot of girls that I've worked with in the past that don't understand that we have different holes for different purposes, to put it bluntly and simply. So here we have the outer labia, we have the clitoris. The urethra is where we pee from or urinate from. The vagina is where our blood comes out. So these are 2 separate places. A lot of women don't realize that they are separate. And then the anus. So this is just important to know. It's important to understand our bodies, how they work. When you're talking about, when you start using tampons or have a conversation about tampons, it's important that girls understand, oh, well, that's not where I pee from. These are common questions, common things I've heard over the years. So it is important to know their bodies and to know their basic anatomy. So speaking of common questions, I'm going to answer some of your common questions because we don't have a Q&A for this particular webinar, so I made a list. And the first one is, how long is a period, and how much blood is there? So I want to preface these questions that I'm going to answer. This is an average. Now, I'm not talking about a girl with a blood disorder when I answer these questions. I'm talking about general, this is across the board average, what happens to girls when they start to menstruate, and women in general. The reason I'm doing this is I think it's important to have a baseline, to understand what bodies should be doing. Therefore, when you aren't experiencing this, you know that you should talk to your doctor. You know what questions to ask and just how to advocate for yourself. Knowledge is power, right? So some girls have their periods for 3 days. Some girls have their periods for a week. On average, it's anywhere from 3 days to 6 days. I know girls with blood disorders often have them for much longer, and that is not the average. Periods can be light, medium, heavy, really depends. Again, as going back to just reminding you that women and girls are different. The average blood loss is normally 2 to 4 tablespoons. Again, this will vary depending on the person. And how we measure that, I mean, it's difficult to measure, right? But you can, and we'll talk a little bit more about this for you and for girls with blood disorders, but you can measure it through how many pads you're going through, how many tampons you're going through. And we're even going to offer an app later on that can help you track that. So we'll go back to that topic. Do girls have their periods for the rest of their lives? No, they don't. But you will have your period for a good majority of your life, close to around 30 to 35 years. Normally, women stop menstruating between the ages of 45 and 51. So it's not something you will have forever, but it is a good part of your life that you will menstruate and have your period. So are pads or tampons better? So this is and what is a menstrual cup? So these are really great questions. I'm going to try and take one at a time. Pads are commonly used when girls start to menstruate. Obviously, it's the easiest. It's what they feel most comfortable with. And all of these depend on your comfort level. Tampons is, again, something that's going to depend on your comfort level. It's a conversation that you should have. They should know about their options. Because young girls, when they're first starting to menstruate, could still be developing, their bodies are still growing, it can be uncomfortable for the first couple of years to use a tampon. But that really, again, depends on the person. I will give you a few tips on when you start to use tampons. It's a conversation you should have with your daughter early on because her friends could be using tampons, and you don't want her getting information from somewhere else. The first few times she tries could be challenging, but it does become easier. Always remind her to relax. Use an applicator tampon for the first few, even years, that can help her to become more comfortable with it. And then the first few times she uses a tampon, you should try to do it on the days that she has a heavier flow. It makes it a lot easier, and it can feel more comfortable as well. So those are all some tips. Also, all the tampon boxes come with the how to use the tampon, and it's good to go over that with your daughter and just talk about it. It can be a really great tool, even before she starts using them, just so she knows how they work and it's in the back of her mind and she just feels empowered and knows that there's an option there. And then what is a menstrual cup? So a menstrual cup is, some people have heard of them, some people haven't. They are an absolutely incredible resource, and I'll talk to you about why. It's a flexible cup, just as it does, that is inserted into the vagina, and it collects the fluids when you're menstruating. It can be super helpful for women who have heavy flows during overnight time, overnight. You can use it with a pad. The other great benefits of menstrual cups is they are reusable. You can clean them and reuse them, and they can honestly help save so much money. They're extremely cost effective because they're reusable. I know we can't ignore the fact that pads and tampons are extremely expensive, especially if you have a blood disorder and your periods last longer, they're heavier. It can be a really incredible resource once your comfort level is there. And I do recommend looking into it. I am not speaking for any specific cups, but they're very easy to find everywhere. You can find them at your local drugstore. You can talk to your doctor about them. The only website, and I'm not promoting this particular cup, but there is a website called Diva Cup, D-I-V-A Cup, if you just Google it. And the reason I recommend this particular site is they actually have some resources on that site for teens. So I'm not promoting the actual cup. You can do your own research on which one is best for you. But there is really helpful and information and educational content on their particular site, which could really help you think through the process. So check out the Diva Cup website for a little bit more information on that. Do I have to stop playing sports? Absolutely not. Everything in your life when you start to get your period and menstruating should remain as normal as possible, as long as you are comfortable. And when you're not comfortable, you should start to talk to your doctor. Tampons can help, as we've already mentioned. I was a swimmer growing up. I swam all year round. And, I was a lifeguard. I was always in water. So I started using tampons because it made me feel more comfortable. And I really didn't have many options. So you don't have to stop playing sports. It is about your comfort level. But it's all the more reason to also talk to your daughter about the use of tampons and how they can work for her. So yeah, that's a great question. And again, if you feel like you can't play sports or that you're having problems with the day-to-day because you feel your period is bringing you down, or you're tired, or you're in pain from cramps, which we're going to talk about right now, again, make sure you have some conversations with your doctors about what can help you. So will I always have cramps? Some people are surprised that not all women even have cramps. So the answer is, again, it really depends on the person. We normally have cramps, just before we get our period or that first day or two. They won't always occur, and how bad they are will vary. I am, in the end, going to give some tips on how to manage cramps. But again, if your cramps are preventing you from living your day-to-day life, you can't go to school, you can't get out of bed, you really need to have a conversation about that with your doctor. And what is PMS? Well, your daughters might hear this term, so you do want to talk to them about what it means. It does include emotional and physical changes to our bodies when we're about to get our periods, mood swings, irritability, bloating, breast tenderness. All of these things can occur, right? Some girls don't start getting PMS until they're a little bit older, if ever. But it is important just so they understand what, again, is happening to their bodies so that they can prepare. And expect, if it does happen to them, expect knowing what to expect, rather. So it's good to talk to them about it, even though they might not get it. And, it's all, again, up to the individual person, how your body reacts to these changes in life. So timing is everything. I actually have a few slides on this. So it's actually best to avoid the quote unquote talk, right? So you don't want to have the one-off where you sit your daughter down and just have the talk. This is what's going to happen. This is, what is, this is what menstruation is. This is what a pad is. This is XYZ. It's best to avoid the one-off and just that one talk. You want to have practical conversations. You want to offer reassurance on an ongoing basis. You want to spread education and discussion over lots of smaller conversations over the years. And I'm going to give you some tips. We're going to talk about some ways to do this. education about your body and sexuality should be continuous. It shouldn't start at the age of, 9 or 10 or whenever they get their period. Making sure that your daughters and girls feel proud of their bodies and that they are empowered and, just feel good about themselves over time will help once they start to get their periods. And always, this is a big one, if they have questions as they grow up even, always answer honestly. How specific you are should depend on your child's health and also their age. So always answer honestly, but there's a degree, right, of things that you can tell them and information that you can give them. As they get older and they ask questions, you might not know the answer, right? I am a health educator. I sometimes don't have the answers for everything. So what you can do in those circumstances is a couple of things. You could say, let's look up this information together. Or could you give me a little bit of time and I'll look into that? If you do it that way, just make sure you go back to them and you say, oh, I found out the answer to the question that you have. And the third tip I would give is make a list. If your daughter has a lot of questions, make a list and take it to your doctor. If you do this with her, she's going to feel empowered. She's going to feel like she's being listened to. And then she's going to get a lot of great answers from her doctor that will help her move forward and feel empowered. So just to continue with the timing piece, other reasons to provide open and honest information is that it will give you the opportunity to right the wrongs. We have all been teenagers, right? Most of us listening to this, we're older, we've been there. We know how much information we heard from our friends. I don't think much of it was correct. I'm trying to think back on my youth, but we want to make sure they have the correct information, and we want to make sure that they hear it from us, right? As parents, as adults. Show your child that they can talk to you openly. And this goes back to having these conversations ongoing and not just a one-off. So if you're talking about this regularly, if you're having these conversations about sexuality and just body image, it shows them that they feel comfortable with you. It will provide them a level of comfort that they might not have otherwise. Allow you to explain it will also allow you to explain that periods are a natural and wonderful part of becoming a woman, not scary and bad. I say this, I wrote this, and I understand and do not want to ignore the fact that having a period for women with blood disorders can be scary and it can be bad. I am not ignoring that in this. What I am saying is that if you start the conversations young, and if you have these conversations regularly, and your daughter feels empowered once she gets her period, it won't be as bad and it won't be as scary because she'll understand what she needs to know. And she'll feel more comfortable coming to you. It really can make all of the difference. So some of this is repetitive, but so it's just how vital I think this information is. Start the conversation before she has her first period. And as I've already mentioned, periods are starting younger. Girls are getting their periods at a younger age. So having this conversation around the time that she's 8 or 9 is super important. You'll want to discuss the differences your daughter will experience because she has a blood disorder. She might have longer periods. She might have heavier periods. Explain to her that it's possible that her experience with her periods will be a little bit different than her friends. And just that it's going to be okay, that you will work through it. It's going to be okay. These are the methods that we're going to use to help. And I'm going to give you some tips in just 1 second to help. And it's going to be okay. But there will possibly be some differences between her experience and her friends. Embracing teachable moments. So this, and can you think of any? So this is, one of those moments where you can jot down some ideas. What are teachable moments? So a couple of examples could be, there's something on TV you're watching a sitcom together and there's something about periods or teenagers getting their period or something's going on where you could just say, oh, what do you think about that? Or do any of your friends have those experiences? Use those moments. Also, has an older sibling started their period? Can you use that as a teachable moment? And just, friends, have they talked to their friends? Have they heard things? So think of others. I know they come to you sometimes when you least expect it, but embrace teachable moments. Rather than having that sit down, teachable moments give you the opportunity to use things that are going on in our everyday lives to have discussions around these types of things. So heavy periods. It's not pretty. It's not always easy to talk about, but obviously it's a reality for girls with blood disorders. This is called menorrhagia. I know most women who have blood disorders know the term menorrhagia, but just in case, because sometimes we go to our doctor's office and they're using terms we don't understand, right? So menorrhagia is the term for heavy menstrual bleeding, and it can cause stress and anxiety for your daughter. Absolutely, there's no question about it, but that's why you should talk to them. So talk to your provider, talk to the HTC staff for support. They can offer you not only emotional stress, but there's also medical solutions. I am obviously not going to go into them. I am not a provider, and I've stressed numerous times already in this webinar that each person is so different, and each method and medical solution will be different for every single individual, teen or adult. So talk to them, see what options they have, how can they help you. Really lean on those professionals that can get you through these what can be difficult times. So an abnormal period is bleeding for more than 7 days. A menstrual cycle lasting 90 days or longer. So not receiving hormonal treatment. So there are some treatments where you don't get your period, so it would be normal not to have your period. But if you are going 90 days from the first day of your period, and then there's 90 days in between that and the first day of your next period, that is not normal. You should talk to your doctor about that. So if your daughter's not getting her period for, say, 3 months at a time, you should also talk to them about that. Menorrhagia is defined as having blood loss is greater than 80 milliliters. So that's 5.5 tablespoons per cycle. So you can remember earlier on, I said that the average person loses 2 to 4 tablespoons. So over the 5.5 is definitely too much blood loss. It's not normal. So as I've already mentioned, I am going to give you an app just before we end. It can help you track how many pads you're going through, how many tampons you're going through, and really keep track of how much you're losing through that. It can be very helpful when you go to the doctor to talk to them about what's going on with your body, what's going on with your cycle. And there we go. So now to the good part, the tips and tricks that I have for you. So some things that can really help. Okay, so we want to always have an emergency bag, right? So this could be in school, this could be vacations, overnights, whatever. In your emergency bag, you should have, 2 extra pair of panties, extra pair of jeans, long sleeve sweater, jacket, tampons, extra pads, panty liners, whatever it is that you use. And then in addition, having a discreet cosmetic bag. I mean, there are the coolest cosmetic bags out there now. So, help your daughter find one. Help her hide it wherever she needs to. Keep it in her locker, keep it in her bag, whatever is the best place to have that for her. We want to try and wear dark colored pants during our periods. I accidentally wore white. I mean, it's one of those things you do when I don't even think I was young. I think I was in my 20s. And you never make that mistake again, do we? So try to wear dark colored clothes when you're menstruating. And my last tip for school in general is to talk to the nurse. So the nurse probably knows that you have a blood disorder. If not, you should talk to your nurse about that. And you can talk to them just in case you forget something. So they might have extra, tampons or pads for you. But also talk to them and see if there's a place where you can keep some of these extra things, the extra pair of clothes. If it doesn't fit into your locker, see if she has some sort of solution for you. Nurses also, will often have a pad or a tampon or a panty liner or something that you can use in an emergency. I don't recommend relying on the school nurse because she could possibly run out of these things or not have them. But still having a conversation with the school nurse about your period and your experience and just medical state is a really recommended idea. So nighttime, get some protective sheets. Use 2 pads, and what you can do is you can have a pad with wings on the regular middle part of your panties, overlap, and then in the back you can have another pad. It would make a T shape, so in the back it would go the opposite way. Again, placing it perpendicular. And then using a menstrual cup can be extremely helpful once you're comfortable. Use a menstrual cup. They are extremely helpful during the night. So put a dark, if you don't have the protective sheets or covers, put a dark colored towel or blanket down in case of leakage. I really like menstrual cups. I put it on this slide as well. Sorry about that, but again, they're really helpful at night. I'm stressing that, I guess. And then also have underwear dedicated to wearing like period underwear for your nighttime. Sometimes you might need to wear 2 pairs. It helps keep everything in place. So yeah, have that dedicated underwear kind of set it aside, and that way it doesn't matter as much if you get stains. If it's not your favorite pair of underwear, you're not going to care as much. So it can be helpful and just a good idea to have separate underwear. Sorry. So coping with cramps. I promised. I told you we would talk about this. So heating pads can be extremely helpful. Talk to your doctor about pain management as well. You want to try and keep up with a regular schedule as much as possible. I know this can be really difficult. You're tired, you are in pain. But when you keep to your regular schedule, it does a few things. It keeps your mind busy, it keeps you active, and it can help. I know sometimes just getting up can be the first step, right? But it can help. Exercising, doing yoga, going for a walk, do something, get out, be active. And I know, again, that's probably the last thing that we want to do, but it's really encouraged, and it can help a lot. Drink plenty of water. Try to limit your coffee intake, try to limit alcohol intake. Well, this is for the moms, I guess. And just try to keep drinking. Try to drink a lot of water. And then again, talk to your doctor. If you are having cramps that are so bad that you can't get up from the couch, or you can't go to school, or you can't go to work, or you can't get out of bed, you really need to talk to your doctor about that. That's not normal. So yeah, again, just sending that doctor message, write down some questions, tell him what you're going through, keep track of what's going on, and talk to your doctor about how they can help with your cramps. Laundry. Every mom's favorite topic, right? So here are some tips to help. So you want to use extremely cold water, and if you don't mind using hydrogen peroxide, it will help to take blood stains. Salt can also help in place of hydrogen peroxide because the peroxide can cause colors to fade, just as a FYI. try to rub out the stains using one or both before washing, so before you wash it. And always keep in mind that if you put it in the dryer, the stain will probably set in permanently. So these are just some helpful tips when you're trying to get those stains out. These are some things to consider. Cold water, salt, or hydrogen peroxide are your friends. So I'm going to end with a period plan. And what this is really things for you to consider when you talk to your daughter. And there's also a plan for your daughter. So something she can think about as she moves forward. So for mom, what can I do to help my daughter prepare for an unexpected period? What can I do? Well, how can we prepare her? We can talk to the nurse. We can have that emergency bag of extra clothes and tampons. We can, there are a number of things, but think through your own, everybody's different, every family is different. What can you do to help her prepare? What teachable moments can I use? So we've talked about a few, but again, as I just said, every family is different. What are some teachable moments that I can use to have this conversation? What can I do to help my daughter prepare for life events, sports, overnights at friends' houses, these types of things, going on vacation, how can we prepare? How can we think through these things so that when it comes up, we're ready? We have a plan. This is what we're going to do. And then this might be the most important point. Who can I talk to if I have questions or I'm feeling overwhelmed? So for you as a mom, this can be, we talked about it being difficult for your daughter, but it also can be difficult for you. If your daughter's having period for, weeks at a time and, you're just not sure what to do and you just want to talk to somebody, who are some people in your life that you can identify that could help you through this? Who is someone you can talk to? It could be your doctor, it could be a friend, it could be anyone, but having somebody in mind who you can reach out to for your own support is highly recommended. You matter too. And, if you feel more comfortable and feel more supported, your husband, whoever it is, your partner, whoever it is that can help make you feel better and more supported in this. So you matter too. So yeah, that's a very important point that I want to stress. So for girls, have your daughters think through these questions. What can I do to be prepared for my period? So, and she could think through, when she goes to a friend's house, when she's playing sports, going to school, all of these things. What can she keep with her and where can she store it? So, like having her come up with that idea, like, okay, honey, where could you keep some pads if, you get your period and unexpectedly and you're out, like where can we do these things? Like have her think about ideas and it'll make her feel more comfortable if she comes up with those ideas on her own. Who can she talk to at school if she gets her period? So it could be the nurse, it could be a teacher she really trusts. So have her think through that. Who can she talk to? And then what other questions does she have? This is a really important one. Have her think through, like, do I have questions? Like, what do I want to know? And again, what this does is it opens up the conversation. It makes her trust you. It makes her feel comfortable coming to you. When she has a question, like something might pop up out of the blue, but if you've already talked through it, she's more likely to come back to you with other questions that she has moving forward. And then, I'm sorry, this is a little bit blurry, but this is our Blood Sisterhood app that I highly recommend. So you can download it for free. You can go to sisterhoodapp.com. Again, that's sisterhoodapp.com. It's down here in the bottom right-hand corner. It's free. You can record your treatments. You can log symptoms, which we discussed. You can, your period, track your period rather, sorry. It's wonderful. It's a wonderful resource. And then here's some tips, sources and resources, kidshealth.org, stepsforliving.hemophilia.org, and some books for you if you're interested in learning more. Okay. And then I just want to say thank you for joining us today for this very important topic. And I hope you learned a few tips to help you moving forward. I wish everyone the best of luck with this transitional time in your life. So I'll back over to Sherry.
Thanks, Christy. That was such an insightful presentation, and I hope you all learned a ton from it. I know for me, I just was taking feverish notes. So thanks again, Christy. I hope you all have a wonderful day, and we'll see you again soon.